So I want to give it just a quick demo of how I use Anutra in the practice. Maxillary infiltrations are obviously something that we do on a routine basis, and especially in the anterior section is possibly one of the most painful injections that we give based on how sensitive things are. So one of the things that you'll notice right now, if you can see, is that there's only 1 milliliter of anesthetic in the actual syringe, because typically we'll put a full carpule in there because we don't have any limitations as to how much we can or can't put into a syringe. We have to use the 1.8 milliliters carpule. I don't need to do that with Anutra. I can pull exactly how much I need. In this case, 1 milliliter is more than I'll probably use. I'll probably use just a little bit over half a millimeter to make sure that his anterior section is fully anesthetized. So the first thing I'll do is when I come in is I'll make sure the tissue is dry, just like we would if for those of you who use topical. I happen to use topical and like topical. One of the main things with topical is making sure the tissue is fully dry before we do anything else. One of the benefits in using Anutra and the buffered system is that it produces a CO2 microbubble, and it can actually produce the effects of a topical anesthetic. And so what I'll simply do is place a couple of drops right on the tissue and let it sit. And over the next 5 to 10 seconds, I'll let that tissue sort of get numb initially, and then I'll pay attention to where the bevel is for my needle, have it facing up. And then as I begin to anesthetize, what I'll do is I'll slowly slip that bevel right underneath the tissue. And almost like you would when you go in for your little TB test, produce a little bubble of anesthetic. And let it take place, and I'll let that sort of settle in. What that does for me is it gives the injection site where I'm about ready to give most of my anesthesia just a little bit of anesthetic so the area is numb. And then I'll literally just go right back in there, and not going straight up into the vestibule, but heading towards the apex of where the teeth are. I'll slowly give an injection. One of the things that you do have to get used to is the rate of the anesthetic. Because of the barrel of the syringe is 3 times larger than what we're used to with our actual carpules, if we see the hub of that syringe move at the same pace that we're used to with our other syringe, we're giving the anesthetic 3 times faster. So we want to be able to slow that down to a snail's pace, and understanding that even though the syringe looks like it's not doing a whole lot, the amount of anesthetic that's going into that syringe is pretty significant. And again, I've probably just used maybe just under half a millimeter of anesthetic, and that should be plenty in order to be able to work on his teeth.